Now, joining us now to help us understand what's going on here is Professor Gabriel Scally, President of Epidemiology and Public Health at the Royal Society of Medicine, a member of the independent S.A.G.E group and previously a regional director for public health in the Southwest. Professor Scally, thank you very much for joining us.
Pleasure.
Now, before I get to the situation with the lockdown and the leak from Cabinet, there is some disagreement as to whether lockdowns work or not. Now, clearly, this is your professional work, and you do this for a living. What is your immediate reaction and response to the Barrington Declaration School of Thought, and what their perspective on this would be?
Oh, Great Barrington! I haven't heard of that for a week or two. I mean, it is complete nonsense. This is a group of fringe scientists funded by a right-wing American economic libertarian think tank, which spends most of their time opposing the notion of climate change. It is really it's extraordinarily fringe stuff. Their adherence to the notion that somehow herd immunity can be created and we can protect all the elderly and vulnerable people. It's an absolute nonsense. Immoral and unethical is how it's been described by several commentators.
You're not pulling any punches there, are you?
Well, it is nonsense, you know. If it's nonsense, it's nonsense.
How would you feel that they would respond to that? Clearly, they're not here with us. So what would they say to you if you said to them, this is nonsense? If you put yourself in their shoes, what would be their scientific reply to you?
Well, they're hardly going to give me a scientific reply, are they? Because they're not public health people at all. And you just need to look at the people, particularly the people in this country who are promoting this nonsense. They haven't believed. I mean,
who are these people? Who are these people? You mean Professor Gupta at Oxford?
Yes, but Carol Sikora. It is, and Carl Hennigan as well.
Do you feel, Professor Scally, that it's in the climate where we are often, all of us, including, I imagine, you, concerned about division, concerned about rhetoric that is inflaming tensions rather than uniting tensions, concerned about empathizing with the other and other people's perspectives? Do you feel it's responsible and appropriate to dismiss an entire school of thought that is scientifically grounded as nonsense and driven by money?
Well, it isn't an entire school of thought. It's a very tiny fringe element.
Okay, but do you think it's fair to levy such charges, or could you not disagree with them on the science?
Well, there is no science in what they are saying. Herd immunity will not work. Secondly, it is not possible, it has not been done anywhere to isolate people and protect people the way they are saying. There are huge numbers of elderly and vulnerable people, and we live in multi-generational households in large parts of the country in large numbers. How is that going to work? How are we going to protect all of these people? And we're going to let the virus run when we are accumulating tens of thousands of people now with long COVID. It's not just the deaths, it's also the persistence of the virus. And that is the public health science. And it is totally at variance with the notions being put forward by Great Barrington and its advocates.
Right, you're in the alternative S.A.G.E. What would the alternative S.A.G.E.'s view be on, if it's proven to be correct, the government's intention to put us into a national lockdown again from Monday evening?
Well, I'm a member of independent S.A.G.E. and there is no alternative S.A.G.E. Independent S.A.G.E. we provide open public advice to official S.A.G.E. and to the government. And we have been calling for some weeks now, as indeed has the official S.A.G.E. committee, for very severe measures to bring the virus under control. And unfortunately, those haven't been put in place yet. And it is a sort of it's a characteristic of this government's response to the whole of the pandemic not to act swiftly enough. It is delay and delay and delay only gives this virus an opportunity to grow, and that's what we've seen now. We are now really in a very difficult situation with the virus numbers, hospital admissions and deaths continuing to accelerate. So it's way beyond time. It is needed now as soon as possible.
And how long for?
Well, that's a very hard thing to say. Some time ago when we started advocating this, a circuit breaker was talked about, and that could have lasted just for a number of weeks. But every time we delay a week or two, the numbers double. The grip that the virus has. So it will take time to get the virus back down again. But the important thing, I mean, if there's one thing that's important, we must also have a complete reform of the failing, indeed failed, test and trace system. Because if we don't have that fixed, well, as soon as we lift the restrictions, the virus will take off again. And you can't have one without the other. They work together.
What is the aim here? When you say we need this strict national lockdown, to what end? What would be your definition of success?
Well, we have to get the virus under control. Now, that means that we have to get the R value down under 1, and we have to get the numbers of new cases really, really down, and we have to get that testing and tracing system working so that people can get their tests.
Sorry, Professor, their outcomes, what's the aim? Is it because why? So the reason I asked that distinction is because
it's to stop.
Forgive me. Let me just put the question back to you because R number being below 1 or above 1. The question would still be why. Now we know what the R number does. The question is why do you want it above 1? Why do you want it below 1? Is it for capacity in the NHS? Is it to until we get test and tracing up and running, track and tracing? Like what is the aim of the lockdown?
The aim of the lockdown should be to stop people dying, to stop people getting infected, to stop people ending up in hospital. It's those things that produce pressure on the NHS and stop other people being able to be treated. So it is about beating the virus. The aim is to beat the virus.
Well, the lockdown, we've never been told kills the virus.
I didn't say kill it.
Yeah. So when they stop the virus, I'm trying to understand what that means. Stop the virus. What does it mean?
Well, to stop the virus transmitting, to stop people
but it will come back,
who have the virus
will it come back if you lift the lockdown?
Other people. Sorry?
Will it come back again if you lift the lockdown?
It will unless you get the testing and the tracing right. Absolutely.
So if I've understood your view, you're saying we need a lockdown that suppresses the virus, not stops it. The word you use is stopped, which is why I got confused, because we know we can't stop the virus, right? So we want a lockdown to suppress the virus with the full knowledge that when we lift it again, it will come back. But you're saying the solution to that then is to have track and trace ready by then?
Correct.
Will track and trace be ready within a month?
Well, could certainly be made hugely more successful than it is now. Hugely. It takes far too long for people to get a test, far too long for them to get to the results, far too few are contacted to find their contacts from them, and far too few of those
So you'd like to suppress, again, just so I understand your view, you'd like to suppress the virus, because you concede that lockdowns don't kill the virus or stop it, so you'd like to suppress the virus until we can get track and tracing done and we can deal with the danger of hospital capacity overflow, and you're saying you want to stop people dying from it in the meanwhile. Do you, in your reasoning, also consider the potential costs and deaths from having a lockdown and weigh them up?
Oh, well, of course. You can't have a response to this virus that doesn't take into account the economic factors and the social factors and the psychological factors, all of that. But all of that damage is caused by only one thing, and that's the virus. And therefore, we have to stop the virus. We have to stop it spreading. We have to stop it being endemic in some communities. When we lifted the last lockdown, it was continued to spread and was still spreading in those.
And so what's the cost of that per day? This lockdown you're advocating for, have you looked at the costing? Because again, I imagine as a public health expert, you weigh all these things up before you make a recommendation. So when you say people are dying, do we know how many die as a consequence of lockdown and what the cost per day for lockdown is versus the cost of not doing it?
Well, I haven't seen the cost per day. I'm not sure if the government has ever produced that. Of course, there is an enormous cost. This virus is producing a huge cost.
Can I give you a
monetary cost and a cost? Of course you can.
I would imagine, though, as a public health expert, you'd have some idea.
The cost per person?
No, per day for the country, for a national lockdown.
The cost to whom?
To the country. Yeah.
Or
you've recommended a harsh lockdown, and I'm wondering if you've looked at all of the the entire picture and compared it to not doing it and decided based upon both cases what the best outcome is. So I'm asking you whether you've looked at the costs of locking down, how much it costs the country, and you said you want to save lives. I'm asking if you've looked at how many lives will be lost because of lockdown.
It is very, very clear, and the evidence is extraordinarily clear, that the countries who bring the virus under control and keep the numbers low have the least damage to their economy. The UK has had huge death toll and a huge amount of infection, and it has done enormous damage.
So
to
what is
its economy.
what is the cost then? What is the cost per day for the national lockdown that you're recommending?
Well, I don't know what the national cost is. We and Independent S.A.G.E, we provide scientific advice.
Yep.
And it is for the government and the exchequer to deal with the finances.
Yeah, but your scientific advice is that people will die, right, if we don't lock down. So I'm assuming you've also looked at how many people will die if we lock down and compared the two to know what best scientific advice to give.
Well, the fewer people that die from this avoidable disease, the better. And the less of the disease we have, the better our NHS will function in looking after all the rest of us. It is COVID-19 that is killing us and our people and our members of the general public, but it's also killing our economy. And the reason it's killing our economy is because it's not under control. Countries that get it under control have a much, much better economic performance over this last 6 months than countries like the UK that have totally failed to bring it under control.
I'm asking you for specifics because I'm aware of the reasoning. You've given us the reasoning, and other people in the country have also heard that reasoning from S.A.G.E and as well as from government. But what I'm interested in is the specifics, because if you want me to believe you, which is, I imagine, the purpose of conversation, then what I'm really interested in is the scientific evidence for why we need to go into lockdown being compared with the scientific evidence for what happens if we don't, and then the death that can come from lockdown versus the death that can come from not locking down compared, and the costs of both compared, so we can have a joined up approach to this and a holistic approach to it. Have you done that work?
I would have done that work had I been a member of the cabinet, but it's actually the government and it's the...
No, but you're Independent S.A.G.E, you're making a recommendation to government. I'm hoping you've done your work.
And we're making it on the basis of our scientific background.
Well, let me tell you, because I've done my homework and I'm surprised you haven't. Shall I give you the cost per day? It's in today's newspapers. You could have plucked one out from Australia. I mean, if you want the British one, I'll give you the British one. But the Australian one, they've just come out of lockdown. They've given the cost per day there. But the issue is that actually, if your argument is about deaths, and I'm asking if you've looked into deaths that happen when you do lockdown as a consequence of the lockdown. I'm arguing if you look at costs, you're saying you want to protect the NHS. If we look at cost per day, can we use that money to protect the NHS without the lockdown?
Sorry, I can't follow your...
Okay,
if there is any logic there, I'm sorry, I can't follow.
Okay, well, I hope there is. There's £2.4 billion a day it costs this country for lockdown. 2.4 billion a day, and I'm wondering if that money could be better spent on bolstering capacity in the NHS to avoid the things you're worried about.
Oh, don't be silly. You are really being stupid there. We went into this...
Sir, I can assure you, I asked you a question. If you're going to get offended, I'll just end the interview. What I did was ask you a question. Have you considered what we could do with that $2.4 billion?
Just let me answer you.
Right, well, don't call me stupid. If you want to carry on insulting someone, we'll end the conversation. Is that how you'd like to go?
No, your question, I think...
Could you not have a conversation without calling anyone stupid? Is that okay?
I wasn't calling you... I said your question is a stupid question.
Right, could you... Well, I would not be comfortable proceeding if that's how this conversation is going to go. So I'll ask you to continue this conversation without insulting anyone. Can you do that?
Let me answer your question.
Well, if you do so without insulting anyone, can we first agree and we can carry on this conveation? Otherwise, it's over.
I'm not insulting you. I think... look...
Yes. So let's continue talking without mentioning the word stupid, shall we?
I'll try and refrain.
Yeah, right. No. Now, back to the... If I put the question and reset the question, then I'll let you answer because that was a bit of a distraction.
Let me answer the question.
Right. So have you figured what this £2.4 billion a day could be used for if we don't go into lockdown?
You asked me about it being used to bolster the NHS. Let me answer the question, please. And it can't be used to bolster the NHS. We went into this whole period with an NHS which was already greatly deprived of resources. We have a huge shortage of doctors and nurses. We are reliant on importing doctors from all over the world to keep our NHS running, even in the best of times. And we know what was happening to waiting lists.
I'm sorry, how does that answer the question, Professor Scally? What could you do with £2.4 billion a day?
You can give the NHS as much money as you like, but they cannot magic up doctors and nurses out of thin air. They just can't. So
that's not really what's being recommended.
You asked me. Oh, come on! You asked me about this. Using that money to bolster the NHS.
Yeah, not today. Not today. That's the cost of the lockdown that happened early in the year. So my question to you was that if we know what's going to happen, instead of going into a lockdown, if we could have used that money to build capacity for the whole year till we get to this point, let me put it to you another way. The drop in the when we talk about stopping deaths, we have a statistician from Bristol University telling us that if there's a 6.4% drop in GDP, you get more deaths from the lockdown than you do from COVID. Has that been factored into your recommendation when you advise government?
But what, this view from a statistician in Bristol?
A 6.4% in GDP causes more deaths from poverty in Britain than the coronavirus.
That may well be, because we haven't got the coronavirus under control. And if we don't get it under control, the virus and the sick people and the dying people will overwhelm our society. They'll overwhelm the NHS and they will overwhelm...
I'm sorry, I don't think you answered my question. The question is, a drop in GDP that goes beyond 6.4% causes more deaths than that what you're talking of. It causes more deaths than coronavirus. And so if we factor in, if we're recommending to government that we need a lockdown, my question to you is, do we factor all of this in together, or are we only looking at deaths that result from coronavirus?
What? The government, I'm sure, factors it all in.
Do you, I'm saying, sir? Professor Scally, you're making the recommendation. I'm asking if you have.
Well, yeah. I look at it in quite a logical sense. If we don't have a lockdown, the numbers going into our hospitals and the numbers dying and the numbers getting long COVID will continue.
So you haven't? Is that the answer no? You haven't looked at the comparative figures of deaths? Lockdown versus no lockdown? Because you're worried about deaths, as am I. You told me you were.
No, I think the point about it is, if we can stop this virus, we don't need lockdowns. Lockdowns should be a last resort.
Yeah, but you're recommending one now, so I'm asking you about your opinion now, and I'm asking whether the opinion you've given to government, the advice you're issuing on air here now, is holistic. Have you compared? You're saying we need a lockdown. I'm asking if you've compared the deaths that come from lockdown and the consequences of the economic hardship versus the deaths that don't, and provided a holistic view. Or have you only looked at deaths that come from coronavirus?
No, we take into account the effect that the virus is having on our NHS and is having on our communities. And that
so the question was, have you considered the deaths from poverty and economic hardship compared to that?
Of course, right? We have.
So what are the figures there?
Well, there are numerous models that are used, and
no, but you've issued an opinion. What is the other figures that your opinion comes from? How many deaths come from the economic hardship of a lockdown versus the deaths from coronavirus? And then have you compared them?
Well, you can't. These are not.
These are models, though. These are not accurate. They are estimates. Have you compared the estimates?
But you're posing these as almost alternatives one to the other.
No, I'm not. I'm saying actually that's not an alternative. You have to look at them together. That's my point. You have to hold them in front of you together, make a comparison, and choose the best course of action. I'm asking you if you've done that.
Of course not, because those are not two courses of action. Absolutely, they are not. If we let this virus go and we don't stop it now, it will destroy tens of thousands of lives. Both those
I'm sorry. Are you willfully ignoring the question? Because I'm asking if you've compared those tens of thousands of lives versus the hundreds of thousands that the head of the UN says of children that would die from the cost of poverty this year alone. So I'm asking if you've compared the deaths and then arrived at a decision. I'm not asking you to restate to me that people will die from coronavirus. I'm not disputing that. I'm asking if the people that will die from coronavirus outnumber the people that will die from the effects of a lockdown and economic hardship. And all I need to know is whether you've considered that. If you haven't, I'd be very appreciative if you did. That's all.
Well, of course we consider the effects of a lockdown, and we consider the effects of not having...
Okay, so what are the figures? If you've considered it, what are the figures? Have you compared the deaths from lockdown versus the deaths that come about by not doing lockdown and arrived at what the most utilitarian course of action is?
The deaths that occur from doing lockdown occur because of the virus. It is all about the virus, and therefore the goal is to get the virus under control and stop the virus so that the economy and the NHS can operate normally.
Professor,
and that is the best outcome.
Professor Scally, thank you very much. You've been a sport. Thank you very much for this conversation. And it isn't my intention to insinuate in any way that you're stupid, so I don't want you to leave with that impression. I hope that you have the same good opinion of me, because I like to think myself as not stupid. But thank you very much for a lovely conversation. You're listening to Maajid Nawaz on LBC, and the time is 3:20. Good afternoon. It's Maajid Nawaz.